Hello everyone, I am Dr. Ashish Agarwal, Director Cardiology at Aakash Healthcare Super Specialty Hospital. Today we talk about stress and the impact of stress on your heart. We know that nowadays more and more young people are coming with heart attack. Previously it was believed that heart attack is a disease of elderly, but now it is not so, and we see that more and more young people are suffering from the disease. Now there are many reasons for that, but today we discuss that stress is being considered as one of the major risk factor for heart diseases in young. Now stress can be either at home and it can be at your workplace. So every step must be taken and should be taken to prevent stress. So how does stress can actually cause a heart problem? Usually stress does not directly cause a heart problem. It indirectly causes a heart problem, or it actually precipitates an underlying condition. For example, if a patient has an underlying minor blockage, these blockages can become unstable because of stress and a patient can come with heart attack. Then there is a condition called as broken heart syndrome, which is called as a Takotsubo cardiomyopathy, wherein as a chronic stress can actually make your balloon out your heart and the heart starts functioning less. And these conditions are fortunately completely reversible if your stress is taken care of. Then stress can also cause some arrhythmias. That means when the patient's heart rate can actually become abnormal, either it becomes very high and it can also become irregular, and stress is one of the major risk factor to precipitate such arrhythmias. There are mechanisms, there are scientific basis of how stress causes these problems in your heart. Actually during stress there are some changes which happen in your body, there are some hormonal changes or chemical changes which happen in your blood. Stress, there is something called as a sympathetic drive, which is actually meant to take care of the situation. For example, if somebody sees a lion, then the first response should not be to face the lion. The first response should be to run. That is called a fright, flight and fight response. So during this response there is a sympathetic drive. That means in your blood the adrenaline levels, they go up. But these should be transient. If these adrenaline levels are chronically raised because of stress, then they can actually damage your heart over long term. So there are certain ways where you can take care of your stress. The first and the foremost thing is that you have to find out why a person is stressed and you treat the reason. Secondly, it has been seen that if you do some yoga, meditation, in some activities which is actually your hobby, or if you go for a walk, or if you start doing a physical activity, that also reduces your level of stress. So we know that to conclude that the stress can actually worsen your underlying heart disease. So every step should be taken and must be taken to cut down the stress in your life. Thank you.